This is a visual learning aid to assist you with learning some of the features associated with the frontalis muscle. The frontalis is one of two muscular bellies that makes up the occipitofrontalis. This is a muscle that again consists of the frontalis on the anterior side and the occipitalis on the posterior side. I'll talk about the occipitalis in more detail on another video. So the frontalis is the anterior belly. It overlays the forehead, as shown here in red, and it has no bony attachments on its own. The frontalis originates from a tough fibrous sheet of connective tissue known as the galea aponeurosis. You may hear this referred to as the epicranial aponeurosis, but I'm going to refer to it as the galea aponeurosis since it'll tie into our visual aid better. The galea aponeurosis is essentially a flat tendon that extends over the cranium, and it forms one of the layers of the scalp. From the galea aponeurosis, the frontalis courses anterolaterally. In other words, it makes its way down the middle and the lateral side of the forehead, and there it inserts on the dermal layers of the skin and the subcutaneous tissue of the eyebrow. When the frontalis contracts, it carries out the action of wrinkling the forehead. Furthermore, it's the only muscle that we have that elevates our eyebrows. To assist with memorization of some of the features associated with the frontalis, I've developed the following visual learning aid and a little story to go with it. So here we have an image of Gal. Gal's a clinician at a cosmetic treatment center, and if you can't tell, she's a little bit anxious and distressed. The term that I'm going to use to describe this personality trait is neurotic. So Gal's primary job is to administer Botox injection. And if you recall, Botox is a drug that can be used to paralyze specific muscles on the face in order to prevent wrinkles from occurring. As you can see, Gal is not really a user of her own product, at least not when it comes to her forehead. Here we see Gal standing at the front door of the clinic, waiting to go inside and treat her next patient. And if you'll notice, the front door has the same coloration as skeletal muscle. In addition to being neurotic, Gal is also a bit eccentric, at least when it comes to her eyebrow makeup. So if you'll notice here, Gal has kind of blonde eyebrows, and that's because she uses blonde eyebrow toner. So if you can recall this quick story in these images, it should help you recall the name of the muscle, its origin, insertion, and action. So the front door, being colored like skeletal muscle, is to remind you of the name of the muscle, the frontalis. The fact that Gal has somewhat of a neurotic appearance is to help you remember the origin of the frontalis, the galea aponeurosis. The fact that her eyebrows are colored blonde is to help you recall the insertion point, the dermis of the skin and subcutaneous tissue of the eyebrow. And the fact that her forehead is wrinkled and her eyebrows are slightly elevated is to help you recall the action of the muscle. To quickly recap, the features of this visual learning aid to help you recall the features of the frontalis are the front entry, which is colored like muscle, so that's to recall the frontalis. The fact that Gal appears distressed or neurotic is to help you recall the origin, the galea aponeurosis. The fact that her eyebrows are colored blonde is to help you recall the insertion point, and the fact that her forehead is wrinkled and she's holding a syringe with a Botox injection is to help you recall the action of the muscle.